Okay, you're doing everything right, low carb, walking after meals, but still your fasting blood sugar is high. You have insulin resistance and you're not sure what else to do. For many of my clients, and I think for many of you listening out there, the missing variable is not food, it's oxygen. And what I'm talking about here is sleep apnea. And I'm making this video because I think a lot of people don't do a sleep study because you're scared of it. And I understand that. So this video is to talk to you about how to get a sleep study, what it entails, what it looks like to demystify this whole process, because it's a very important thing to get done. All right, so the why here is sleep apnea makes you tired. You don't feel good during the day. It's also an independent risk factor for diabetes and heart disease. Well over 50% of adults have it. So get it checked out and get it treated. And the first step to doing that is doing a sleep study. So what a lot of people think when they're recommended to do a sleep study, they think they're going to go into a lab, be hooked up with things, and try to sleep in a strange place. And that is not what's going to happen. That does happen for some people with severe sleep issues, but that's very unlikely to happen with you. You'll go to your doctor, or you can order one independently, and I'll link to the labs below that I know of. And you'll order a home sleep study where they deliver the things, and I'll show you all the stuff, and you put it on and you sleep in your own bed. So it is not as scary as you think it is. Your doctor might order this. Your insurance will likely cover it, but not always. If your insurance doesn't cover it, they can tell you what the price is when the lab calls you, but it's in the $200 range if you end up paying cash. But whether your doctor orders it or you order it, you'll get a call from the lab. They'll talk you all through it, including the pricing and what's involved. You'll feel really empowered with all that knowledge. And then they ship you the kit. And when you get the kit, you have a week to do 3 nights of home sleep study. All right, are you ready to show me are you ready for me to show you what's involved? So they send you this kit in a box just like this. And there's 3 main components. The first one is a chest strap that goes around your body, and it goes on the outside of your clothes. And this holds this little sensor box, see, just like this. And the sensor box will tell the lab, were you sleeping on your side during that time or on your back? And various things will plug into this. And this is roughly the same for most of the labs. And the other part of it is a nasal cannula. And this is that gadget. And the things kind of go up your nose. They don't bother you. And trust me, I'm a princess with my sleep, and it's fine. Goes up here, and that measures the air coming out your nose. And some of them, like this particular brand, they also measure the air coming out of your mouth if it's available. Now, you will see these pieces of tape here. They don't come with a system, but what I like to do is I think it's best practice to tape them in place so it doesn't shift and it stays in place better if you're rolling around on your side. So the box, the nasal cannula, and the third piece is always a pulse oximeter. So this something will go around your wrist, and this one will go around your finger or your thumb, and it measures your blood oxygen. That's it. So those 3 bits of kit, and they go on, and you wear them at night while you sleep. And I think you need a minimum of 3 hours, or there's a minimum amount of time to get the data that they need for the day. And you usually need to do 3 nights. Now, I will tell you, does this disturb your sleep? Both times I have done a sleep study, I have been a light sleeper the first night because I was all worried about the system. But if you tape the things in place, they will be more secure. And both times I've done this, again, I'm a bit of a sensitive sleeper. I slept very lightly the first night, and then the next 2 nights, I slept just fine. It's really not a problem. So once you get those results back, they will go to your doctor if they ordered it, and they'll come to you, and then you have a chance to talk to the lab, and they talk you through the results and what the recommendations are based on those results. I find this really empowering, gives you a lot of information. And if you do something like a dental appliance or CPAP or something like this, then it's usually recommended to repeat the test with that in place to see if it's working for you. All right? It's just a great thing to do. It's not as big of a faff as you think it would be, and very few things will disrupt your blood sugar more than poor sleep. So as I talk about in my book, Hack Your Blood Sugar, you want to find out your root causes, whether it's food, lack of exercise, inflammation, or poor sleep. And this really fits into that category. So in the description, I'll be sure to link to my book. I will link to a couple of the labs that do these sleep studies. And I really encourage you to look into this. And finally, If you appreciate this content, please remember to hit like and subscribe.